Hi, welcome to Helios Cancer and Hematology Clinics. In our clinic, we get a lot of patients who come for treatment for both early cancers, advanced cancers, and also cancers which have spread to other organs. And believe it or not, one of the most effective treatment for the treatment and cure of early and locally advanced cancers involves chemotherapy. Should you be afraid of chemotherapy? Not really, because chemotherapy is not just one single drug or one single treatment regimen. Chemotherapy is a term that encompasses multiple drugs that we have at our disposal for treatment of different cancers. You should be aware that the treatment that we give for breast cancer may be a lot different from the treatment that we give for bone cancers, and the treatment that we give for lung cancer may be a lot different than we give for the treatment of ovarian cancer. So chemotherapy is not one single drug. The most dreaded complication that we see during chemotherapy is not vomiting. And why I say that is because we have at our disposal some amazing medicines which have come in the last 5 years, which have reduced the incidence of vomiting by more than 99%. During my practice at Helios, we have frequent questions from patients and patients' family about, doctor, what to do about vomiting, what to do if I get gastritis, what to do if I always don't feel like eating food. And my answer to them is, it depends on the type of treatment that I am going to give you. And how do I manage this discussion is by telling them that this feeling that chemotherapy causes vomiting has come from 1980s and 1970s, where we used to have only 5 to 10 drugs and we used to use them for various cancers. All these drugs were extremely powerful. They would not be well refined as it is being done today, and due to that, the side effects used to be much higher. You would be surprised to know that almost 70 to 80% of the chemotherapy drugs are not known to cause vomiting. There are a lot of chemotherapy drugs that do not even make you lose one strand of hair. So, folks, do not be afraid of chemotherapy. A medical oncologist and a hematologist like me will be able to tell you that which of the drugs I am going to be using for the cancer that you have been treating with, and what are the side effect profile of the drug. In fact, there are many drugs which don't have don't have any side effects. So it is something that I am going to be discussing with you so that we understand each other as to what to expect during your treatment journey. So we have a lot of medications right now. We have the NK1 antagonist, and we have the olanzapine, which has been used very commonly now. We obviously use medicines such as ondansetron, palnositron, and granisetron, which are very powerful in preventing vomiting. We also use certain medications after completion of your chemotherapy session so that you do not get any vomiting. We use low dose steroids for all patients who have who are being treated with drugs which can cause high incidence of vomiting. So due to this combination of medicines that we use after giving you the chemotherapy drugs, the incidence of vomiting comes down by more than 98 to 99%. So it's very important for you to know that you need to have a discussion with your doctor regarding your treatment journey. What are the positives, what are the negatives, what are the limitations, and what are the advantages. Thank you.